Hi everyone, I'm Christy Nielsen, and this video is for you as the staff nurse who will be precepting nursing students who come from concept-based learning curriculums. And a concept-based learning curriculum is one in which students are taught key foundational concepts to such an extent that they can transfer those concepts across any clinical setting to have a greater extent of clinical judgment, and it's all about pattern recognition. This video will provide you with some examples of how you can help students learn conceptually in any kind of clinical environment. Okay. Well, good morning.
Good morning.
My name is Christy.
I'm Kristen.
Nice to meet you. I'm glad you're here with me today. So, what are you learning in school for your concept this week?
Fluid and electrolytes.
Okay, well that's great.
Yeah.
We have some perfect patients. Now, it's going to look differently than what you've seen as far as concept-based learning in clinical, because we have an assignment of patients. So I will ask you questions concentrated toward fluid and electrolytes, but we still have to take care of the whole patient.
Okay.
And then we'll discuss it later after we take care of some of the patients. So what I'll be wanting for you to do is look at the patient environment and look for similarities and pattern recognition so you can see trends in how we're taking care of patients with fluid and electrolyte imbalances.
Okay.
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 So let's go. Oh, before we do that, let's
Gotta see the
let me
patients.
let me talk to you about the patients. So the first patient we're going to see is Jane, and she's been here for 2 days, and her diagnosis is heart failure.
Okay.
Then the second patient we'll see is Bryn, and she's been here in the past 24 hours with a diagnosis of nausea and vomiting and dehydration.
Okay.
Okay. So now we'll go.
All right.
All right. Good morning, Jane.
Hi.
I'm Christy. I'll be your nurse today.
And I'm Kristen. I'll be your nursing student, so I'll be following her around.
Okay. We're going to do just a quick check on your skin and your ankles to see how you're doing, and check your feet.
Okay.
But I do want to know first how your breathing feels today.
It's a little bit better.
Can you describe what better is?
It's easier. It doesn't feel as hard to breathe.
Are you on oxygen at home?
No, I'm not.
Okay. Okay, we're going to touch your skin, and I'm going to be talking to Kristen while I'm checking you too, so just so you know. So we'll just pinch her skin to see what kind of trigger she has. And then
Trigger
we're going to
looks
look at your
good.
feet too.
Okay.
Okay, there's some swelling in your feet. So I can put my finger into it and it kind of stays for a little bit. How was it yesterday?
They're usually worse than this.
Okay.
Do you have any pain in your ankles?
No pain.
Okay.
Better than it was yesterday?
Yes.
Okay.
Okay, we'll cover those back up.
That's good. That's good. That means the medicine's working that they were giving you. And then I just want you to pay attention to the IV fluid to make sure, we always check to make sure it's the correct IV fluid that the physician ordered. This is half normal saline, and that's at 50 mils per hour.
Okay.
So we'll talk about IV fluids a little bit later.
Okay.
How about her urine output?
The urine looks pretty clear, actually. It's about 1,500 milliliters.
Okay. So we are going to go check our other patients, but before we go, we want to make sure that you don't need anything.
I think I'm just gonna rest.
Okay.
All right. Well, if you say Chris, one of us will answer. It's pretty easy.
All right, thank you.
Mm-hmm.
Good morning, Bryn.
Hello.
My name is Christy. I'll be your nurse today.
Hi.
And I'm Kristen, and I'll be the nursing student following her around.
Hi.
So we're going to do just a quick little overview of your skin and your ankles. And first, how well did you sleep last night?
I slept okay. I was up a lot going to the bathroom.
And is this the first time you've had problems with nausea and vomiting and diarrhea?
Yeah, it's not normal for me.
Okay. Well, we're going to look in your mouth first. Stick out your tongue, and then always check their lips too to see if they're dry.
Okay.
So I'm going to be talking to Kristen while I'm doing this too, if that's okay.
Okay. Yeah, that's fine.
Okay, and we're going to check your skin on your arms. Okay. What are you thinking?
It looks pretty good to me. It just looks a little bit dry.
And my hands are cold, I apologize. And her IV site, we'll always check the IV site.
Okay.
Okay, your IV looks good. Now we're going to check your feet and ankles. And what are you finding?
I'm not really finding any edema. Are you?
No.
Okay.
So-
Her skin feels a little dry to me.
Okay, that's what I That's what I find too. They're kind of dry and scaly, like you need lotion kind of looking, but that makes sense with your dehydration. Kristen, if you would look at the urine output.
Okay. So the urine actually looks pretty concentrated. There's about 30 milliliters in there.
Okay. And then the other thing you need to look for is IV fluid to make sure the IV fluid that's hanging is the correct fluid. This is lactated ringers, and the rate is at 125 mils per hour.
Okay.
Okay. So now we're going to go see our other patients, but before we go, do you need anything at all?
Maybe something to drink, please.
Okay.
Okay, we can do that. Anything else that you need, you can just yell Chris, and one of us will come and answer to that.
All right, thanks.
So, how's your day been so far?
It's been really good. I've learned a lot.
So tell me about some aha moments you had and what you noticed as similarities and differences in what we did and the types of treatment for patients with fluid and electrolyte imbalances that we care for today.
I was really surprised that there were similarities between the two patients as far as the assessments, even though there were different diagnoses. I noticed that we always checked the skin right away and the mouth and moved down to see if there was any swelling or edema in their feet and ankles. Always checked their intake and output and their IV access and the fluids that were running. And then, you know, always asked them just kind of how they're feeling and what we can do for them. So,
did you notice similarities or differences in the types and rate of IV fluid?
differences. So for the first patient, I noticed that we had half normal saline, and that was at 50 milliliters per hour, which would make sense because she was had a lot of extra fluid, and so slower that rate down. And then for the second patient with the lactated ringers at 125 to put some electrolytes in her body and replenish her with that.
And how about lab values? What lab values were the same or priorities to look at in patients with fluid and electrolyte imbalances?
So I would say the most important ones are potassium and sodium, because those can tell you a lot about a person and how they're doing. So.
Very good. You did a very good job today.
Well, thank you.